Good morning. Good morning. I just wanted to introduce my husband, Matt, and we're going to talk about the glucose monitor here just for a minute and why it's a good idea, my little 10-day experiment, and what I'm doing. Go ahead, honey.
Oh, well, I think it's important for them to know that I'm Western medicine trained nurse practitioner. I've done certifications in functional medicine so I can do integrative care. And of course, you are a functional medicine counselor, and we go back and forth about things and really come up with good stuff. You know, um, anyway, get to the problem and the root of the problem.
So, with obesity and diabetes and dementia in my background on both sides, do you think it's a good idea for my 10-day experiment using the glucose monitor?
I think it's an excellent idea. Those are risk factors, um, and doing the monitoring. If anybody's concerned with weight or not, or what their blood sugars are doing because of family history, what have you, just want to see the impact of their diet and what it does with blood sugars, and to check things out for themselves, I think it's a great idea.
So, do you think that insulin resistance plays any kind of a part in diabetes or any of those things?
Well, yeah, insulin resistance is a big part of diabetes. You know, because of time, basically the insulin puts the sugar into the cell, and if you don't have enough of it, or you have insulin that's not really good insulin that your body's producing, then it stays floating outside in the bloodstream, and that's what causes all the problems, because it needs to be in the cell where it can energize it.
So, if somebody wanted to do what I'm doing, how would you recommend that? Do they just go to their doctor and see if there's they can order it or a sample, or how does that work?
Well, I tell my patients it's a pretty safe thing to use. There's no harm in it. It's a little sensor that goes on your arm, and then you usually download an app on your phone. There's a number of different brands out there. I don't prefer one over the other. And some even had like a free 10 to 2 week trial where they send one to you for no cost. But you can always check with your primary care provider, and have them do a prescription if needed, or give you a little more direction on that.
So, I think the whole thing, too, why I'm so concerned, because in other countries they call it type 3 diabetes, dementia. So, for me, with my mom and my grandpa dying from that and whatnot, it brings hyper awareness for me. Do you recommend that too, just to bring awareness?